I'm Annie Lin with UT Health East Texas Gastroenterology Department, and here are 5 things you need to know about inflammatory bowel disease. Inflammatory bowel disease, or IBD for short, is a group of medical conditions that cause chronic inflammatory activity in the bowel. And the 2 main inflammatory bowel diseases that we know of are ulcerative colitis and Crohn's disease. Symptoms of IBD can really vary from person to person. If someone has very mild or an early IBD, they may notice nothing but just a little bit of diarrhea, perhaps some rushing when going to the bathroom, or some fatigue. However, as the symptoms progress or becomes more severe, other types of symptoms may occur, such as abdominal pain or rectal pain. Different laboratory tests and imaging tests may help us to diagnose IBD, but usually IBD diagnosis has to formally be made with tissue biopsy, usually through an endoscopy or a colonoscopy. Depending on the severity of the disease, other medical conditions you may have, and other considerations that your physician may ask you about, there are pills, injectable medications, and infusions to help with acute IBD flare, as well as treating long-term IBD symptoms. It is a chronic disease that requires long-term treatment, and we need to continue to monitor you through lab tests, imaging, and interval endoscopies. If not adequately treated, IBD can cause some severe complications such as colon cancer, life-threatening infection, and perforation of the bowel, which may require emergent surgery and may sometimes lead to death. More commonly, in chronically untreated IBD, you may develop iron deficiency anemia, malnutrition, and weight loss. The disease also interferes with the body's ability to fight off infections in the gut, so you may be more susceptible to severe infections in the GI tract. We are set up in many ways to provide patient-centered care that is attentive and personalized to your needs. We have a state-of-the-art infusion center at our facility where staff members will assist with expediting approval for your treatments, and all infusions will be done under the watchful eyes of an experienced infusion nurse. We are involved in several clinical trials for promising investigational therapies. Once you are established with our clinic, you will have direct contact with an IBD nurse coordinator who will be readily available during clinic hours if you have questions or need assistance.